We are on the air. Let's roll. Kish, how you doing? Kizzy, good to see you. Gwen, good evening to you. Thank you for joining us. Glad to have you. Katina is on. Good evening to you. Alicia, good to see you. Thank you. Melanie is on. Good evening. Thank you for joining us. Erica is on, which means my Maya is on. Hey, Maya and mommies. Karina is on. Good evening. Gwen is on. Good evening. Lakista, hello. Good to see you, Patrick. Good talking the other day. Erica is on. Kiva, what's up? Barbara Pinckney, good to see you, ma'am. It is Friday. Christy, thank you for joining us. Angela is on. Hello, Angela. Erlina, good evening to you. Denise, good evening to you. Chelsea, good to see you. Sarah, hello. Good to see Lorraine is on. And Princess, good evening. Good to see you, Barbara. Hello, Denise. Good to see you. Let's see. Marthea, good evening. Shauna, good to see you on. Good evening. Tiffany, hello. Trine, afternoon to you. Katina, good evening to you. Harold, I've been vaccinated, bro. I got the thing right here. Gloria, good to see you. Glenda, good to see you, Glenda. Joan is on as well. Ruel is on. Gina is on. Brenda, good evening. Jackie is on. So I got the little thing that says vaccinated. I don't know if you can see it. Let me get it up here so you can see it. I'm vaccinated. Vaccinated. So anyway, let's see. What else? Jackie's on, and Sheila, I was waiting on you too. Cheryl is on. Good evening. Nakia, good evening to you. April had 2 COVID scares this week. We are glad that you are negative, and I believe that inmates are being vaccinated. Sharika, good evening to you. And Patrick, we'll talk about it. E. Joyce Paris is on. Jackie is on. Good evening. Lacey, good evening to you. Lenora, good evening. Good to see you. Jason, good evening to you. And Cynthia is having crab legs. I saw Cynthia in Publix, and she said she was having crab legs on date night. So she's not going to share, but good to see you, Cynthia. I'm seeing my interferences coming on and off. I don't know what that's about. Kiva wants to talk to me about my extended warranty. My extended warranty on what? I don't know what that's about. Oh, I know why. Wait a minute. Let me make sure my Shauna. Yeah, what a week. Let me make sure my Wi-Fi is on. That might be a part of the problem. Andre, thank you so much for joining us. Glad to have you. Tammy. Well, we hope you're all right, Tammy. Coach Cassell is on. Good to see you, Coach. Barbara Kaufman is on. Good to see you, Ms. Kaufman. So we got one Kaufman. Tia is on. Hello. Lauren, good evening to you. Adrian is on. Good evening, Adrian. Latrice is on. Chiquita is on. Always good to see you. Let me see. All right, there we go. Okay, it's saying my internet might be down. We'll push through. Hey, Sonya, where'd I get that? It's Sonya. It's for people in Savannah, in Savannah. So you come to Savannah, we'll get you one. Hannah, we did miss you, and Crystal Kaufman is on. So that means we have both Kaufmans on. Pamela is on. Savannah, good to see you, Savannah, and good to see April. April, we had a good conversation about you. Thank you for all that you do. Antoinette is on. Jacqueline is on. Erica, good evening to you. Lily Reddick is on. Alicia, good evening, ma'am. Mari, hey. And Jackie gave up tonight's run to see me. I am honored and glad that you did. Thank you. Omega is on. Kimberly is on. Good to see the Honorable Cynthia Elaine Jenkins, the Mayor Pro Tem of Noonan, Georgia. Glad to see you. Janet is on. Good to see you. Miko is on. Good evening. LaMonica, thank you for joining us. Sherelle is on. Good evening. Rose, good evening, Rose. And good to see Sean all the way from Richmond, Virginia. Good evening, Nat. Good to see you today. Linda, good to see you on as well. The Lala one about the new car. We'll talk about it. I know, Jacqueline, I know. I switched computers today to try to see whether it will give me a better thing, and it's not. But, we'll push on anyway. Good to see you, Cynthia. And Julie and Julius Johnson. I think you meant Julie. Good to see you. Demetra, good to see you. Dana, happy Friday to you as well. Kiva, no problem at all. Good to see you. Tony, Tim is on. Miss Flo, good to see you. Tia is on. Jackie is on. Lahoma, good evening to you. Tia, hello, good to see you as well. Susan, hello. And Andre has sound, so we're good to go. And Gwen is on. Beat is good in Georgetown. Jackie Jones is watching. Shanice is on. Greta, hello. I'm just saying Omega got her third shot. All right, look at you. Jean is on. Joan Cookie is on from North Carolina. Coach, I'll take care of you. Deborah, good to see you. Good to see a real doctor on here. Dr. Heather, good to see you, ma'am. Thank you for joining us. Priscilla, hello. Pastor Thomas Williams, thank you for joining us. Glad to see you the other day. Vondell, hello. Good to see you as well. And Shakira, what's up? Good to see Carolyn on. And if Carolyn is on, that means that Savannah is on. So, hey, Savannah. Jonathan, thank you for the encouraging word. And Shauna got some words from us. Good to see Demetrius from North Carolina, but his family is still in the Pope. All right, Sandra, good to see you. Bianca, you were going in. I want you to be nice today. Hopefully nobody will get out of line because you were going in. Ted, good to see you as well. Let me see who else. Nisa is on. Good to see Paul. And Lala is watching the NFL games and watching me. Angie from the DMV and the SAV is with us. Carolyn, good to see you. Teresa, good evening to you. Glad to have you with us. Angela's on with us. Hey, Jay. Hey, Carolyn. I hope you're doing well. I think you were supposed to call me. I think you were supposed to call me, Carolyn. Melinda, good to see you. Andrea, I agree with you. Kathy, we'll talk about that. Good to see Sarah on, and Mary Ann is on. Latrell, good evening to you. Georgette, I called you back and you didn't answer, so we're done. Kiva, we can discuss schools as much as I can discuss them as well. Good to see you, Delisa. Tanisha is on. Latricia is on. Kwame Khan is on. Good to see you, Twiggy. I hope your mama is doing well. Norda, good to see you as always. And Shanika is on as well. L. Griffin is on. Shauna is on. Hola. And hey, sending out love. Pete, man, look, I am so glad to see you, Pete. I was really, really worried about you, Pete. I mean, really, really worried about you, brother. And I hope you are doing better. I really hope that you are. So I'm glad to see you, Pete. You had a really rough journey there. So I want to make sure that you're all right. Let's see, who else? I lost my stuff. Let me see, I lost my feed. Let me catch up. I was on a roll, and I stopped with Pete because I was so happy to see Pete on. Now it looks like you're okay. Shakira, good to see you. Mr. Andrew Brown is on. Philip, what's up? And of course, Laura is on from Pennsylvania. Good to see you. And Bella, hello, good to see you. And oh, Bianca, you in Hawaii, and you didn't even take Your mayor with you? What's up? My auntie for real is on. Good to see you, Neat. My real auntie, like my for real blood auntie, is on. Good to see you. Hey, Terry, good to see you as well. Thank you, Julia. The amazing, awesome Lori Lewis is on. Good to see you as always, ma'am. Pastor Lloyd, good to see you. Thank you very much. No, Carol, I think you were supposed to call me, I think. Beat says, where do you get the vaccine bracelets? I think you get them when you get vaccinated at the health department, I believe. Nicole, good to see you. Josette, I'm sorry, I have this thing called a job. And so, you know, I just can't, like, get off of my job to call you because you called me. I called you. I mean, you need to answer when I called you. I called you back. But anyway, Nicole, good to see you. Joanne, hello. Thank you. I appreciate that, Lucille. It was a great conference. Lenard, good to see you. Carolyn. Audrey, hello. Thank you so much. Priscilla, I did not see your response, but I will. Let me see. Chris, we will talk about that. Julia, good to see you. Diana, hello as well. James Putney, your wife has my mailing, my email address, Putney. Just ask Sabrina. She has it. Catherine is on. Tanja, I hope the family is doing better. Y'all are in our prayers. Good to see you, Megan. Wow, Pam has healing from COVID. I'm hoping you're better, Pam. We need you. But COVID don't stand a chance against you. COVID don't want none of you. And Rayella is in Missouri, but I'm glad that you're with us here in Savannah. John, thank you so much. Sharon is on all the way from Midway. Jaquil, good to see you. Chanel is on. Ty Lee, hello, hello, hello. Elise, good evening to you as well. And Nicole says that Terry says, hey. Thank you so much. Andrea Hall Houston, thank you for joining us. We're going to go ahead and roll. I think we are a little over 300. So let's go ahead. Let's get into it. Let's do this. If it's Friday in Savannah, good to see you, Pastor Gunn. If it's Friday in Savannah during the pandemic, if it's Friday in Savannah during the pandemic, and you're keeping the faith but following the science, if it's Friday in Savannah during the pandemic and the numbers are out of control and you don't have nowhere that you have to be, Pretty Brown, good to see you. Tracy, hello. If you have no place you have to be, then you are home. You are home in the house with people you live with, and you are with me. It is date night, Friday, August the 20th, 2021. Friday date night. We have been doing this now for 74 weeks. 74 weeks since March the 19th, 2020. We have gotten together every single Friday since March the 19th, 2020 to today. 74 weeks. We did it on the day after Thanksgiving, day after Thanksgiving. We did it on Christmas Day. We did it on New Year's Day. That's how we roll here in Savannah, being Savannah Strong. And we have done it because you have joined us, and we have done this together. Because I couldn't do it unless you were here. So I appreciate you all. I cannot tell you how much this means for all this. Elizabeth, I love you too. Thank you so much for being with us on 74 consecutive weeks of date night here on Friday. We call it Friday Night Live. So we were moving. So a couple of things we want to do. First thing is this. The first thing is this. Like the page. Do me a favor and please like the page. Mayor Johnson SAV. Take a moment and like the page if you have not done so already. Please. Sarah Stevens, good to see you. Like the page. Good to see you, Madame Gloria. Thank you so much. Ed Beatty Jr. is on. So, Ed, if you would set the protocol for tonight, because you weren't here last week, and I think they acted up. So let's talk about it. Let's talk. go ahead, like the page. The second thing I want you to do is share it. So good to see you, Judy Wilhite. Good to see Pearlette on as well. Good to see all of you, and I appreciate you. So I want you to like the page. Then I want you to share this video, because we are not jealous here at Friday Night Date Night. We know for us, the more the merrier. And here on Friday nights, we expand the table from people all over the country who tune in. Some of y'all that speak and a whole bunch of y'all that don't. And then some people don't want me to know that they're watching, but I know that they're watching because they're just monitoring to see the stuff that we're going to talk about. And I do not mind if you want to be a voyeur on our love fest here in Savannah, where we spread love and we speak truth. So for those of you that are watching, we want you to watch, and we hope you enjoy what you watch, because we're going to give you plenty to talk about as we do every Friday night here on Date Night. So again, please like the page. Secondly, share this video. So I wanted to take a moment of personal privilege. I wanted to wish a very happy birthday to one of my spiritual mothers, and in the person of Overseer Prophetess Idell Cheever. Good to see you, Skylar and Tony. Debbie Williams Walker. Okay? But it is Prophetess Idell Cheever's birthday. And she is just an awesome woman who loved me before I was anybody. And so I wanted to give her major love today on her birthday. Overseer Idell Cheever. Happy birthday to you. And I just wanted you to know that I love you and I appreciate you, and I hope that you had a great day. Ursula is in Dallas watching, and I know that Rockin' Robin is on. She's from Kansas City, but she's in D.C. Robin is always traveling, so she could be watching from anywhere. So I wanted you to like the page. I wanted you to share the page. I wanted to give happy birthday to Mother Apostle Idell Cheever. And so we love her, and I love her, because she prayed for me. She prays for me when people pray on me. You think about that. Sierra, good to see you. Steve, good to see you, brother. When people pray on me, P-R-E-Y, she is praying, P-R-A-Y, for me and for this city. And so her prayers keeps the praise off of me and off of us. So just love that awesome lady, and I just wanted to wish her a happy birthday. And I know all of these folks are on from Pentecostal Miracle Deliverance centers all around the world, and I know y'all will tell her that I wished her a happy birthday. I did talk to her earlier and wished her a happy birthday. So let's get into it. So let me just tell you what's going on. Good to see you, Jay Chris, as well. But let's talk. So in Savannah, our 7-day rolling average. On July the 2nd, our 7-day rolling average was 9, as in the number 9. On July the 2nd, it was 9. Today, it is 289.4. On July the 2nd, it was 9. Today, it was 289.4. Okay? Our community transmission rates in Chatham County. On August the 6th, it was 677. 13 days later, it is now 1,270. On August the 6th, it was 677. And today, it is 1,270. Good to see you, Pastor Cheryl. Our positive test rate on July the 23rd was 13.9. As of the August 13th, which is the latest date we have them, it was 19.6. As of right now, about 268 people are in our hospitals. 268 people. 140 are at Memorial, 70 are at St. Joseph's Candler, and 70 are at St. Joseph's and 58 are at Candler. So at Memorial it's 140, at St. Joe's it's 70, and at Candler it's 58. Okay? Good to see you, Julia. So I just wanted you to know what is going on. Again, we just going to talk facts here. To understand where we are. Our numbers have peaked. So we're doing what we can to be able to continue to keep our community safe. We have asked people to get vaccinated. People who don't know what the FDA stands for says, well, it's not FDA approved, but they take vitamins and minerals in which are not FDA approved either. The current vaccines, Johnson & Johnson, Moderna, and Pfizer, are FDA approved for emergency use. For emergency use. So approval has been given. And I want to be very clear about that. Now they're expecting, Teresa says her sister from Columbus is watching. Well, hey, Teresa's sister from Columbus, Georgia. We're expecting that within the next couple of weeks there will be FDA approval. And then some folks will try to find a reason not to get vaccinated then. You know, I mean, it just is. So now we have more people who have been infected than have ever been infected before. Our rates are through the roof. Our hospitals are full. Our healthcare heroes are stressed out again. And again, shouts out to our nurses, our doctors, our techs, our dietary folks, our environmental health and custodial staffs, and people working in our hospitals. Shouts out to those medical professionals and admin professionals who are working at our federally funded healthcare centers, J.C. Lewis and Curtis Cooper. They are testing more people than ever before. There are people waiting in line for hours to be tested when it only takes a few minutes to be vaccinated. You're waiting for hours to be vaccinated, to be tested, when it only takes moments to be vaccinated. And what is happening here is that people are terrified when COVID invades their home or invades their child's classroom. Good to see you, Tanya. Good to see you, Cynthia. Good to see you, Edna. And so then all of a sudden, we want to get tested. I'm getting off calls in my office. How can we get testing? How can we get testing? No, get vaccinated. Get vaccinated. And so the hospitals are telling people that essentially, if you don't have, that they may not be able to help you. If you have medical issues that are not considered absolutely life-threatening, then if you go there, they may not be able to help you. Hey, Nanette, good to see you. And that's the issue. So you might say it doesn't affect you, but then all of a sudden something happens and you got to go to the hospital or you got to go to the doctor, and then you're not able to get what you need. That's the problem. And it appears I've frozen. Let me see what's going on. Did I freeze? We'll see. Did I freeze? Danetta, good to see you. Wait a minute. Okay, I'm back, I think. I think I'm back. Okay, if I'm still here, we'll keep it rolling. Okay, I think you hear me. All right, it just appeared that I froze. So we need to understand that we should not panic when we have the ability to take control of our situation. They are telling pregnant women that we may not be able to deliver your baby right now because we don't have room to deliver your baby. So it affects everybody. Good to see you, Pastor Little. And so that is what our challenge is. And so what I'm asking you all to do, as best as you can, hey Janice from Virginia, to be able to start backing off of some of the stuff that you do. Right? Now, let's talk about yesterday. So, we reinstituted the mask mandate for city and public facilities, but it was an opportunity for our businesses and communities to recognize that our numbers were going back up. And we wanted to get people in the mode of saying, let us proactively do what we can to get ahead of this. I was just in Philadelphia this past week, and I was at the Philadelphia Marriott. The Philadelphia Marriott is connected, for those of you that know, with the Philadelphia Convention Center. Huge hotel. I've stayed there many times. And they have been closed for the last 17 months. And our group that was there, this was the second group that they had in 17 months. This entire hotel had been shuttered. Now, we were blessed here in Savannah because we kept the faith and we followed the science, because we had businesses and people and houses of faith deciding that we were going to work together to be proactive. We were going to wear our mask. We were going to wash our hands. We were going to keep our distance. And when the vaccine was available, we were going to get it. Our businesses did not experience what other businesses had experienced across the country. Our city did not experience what other cities experienced around the country. So the mask mandate part 2 was an opportunity to warn our citizens that we were heading down the same dark road that we were on before. As a matter of fact, it was not as stringent as the last mask mandate, because we wanted people to give people the opportunity and businesses the opportunity to get it together themselves. Okay? So yesterday, I get a call. And the call said, get on, watch the news because your governor is speaking. Now let me get something to drink. Wait a minute. Okay. No shade intended. But Governor Brian Kemp, again, in Georgia, where we don't have Medicare expansion, in Georgia, where we're not even 50% vaccinated, in Georgia, where there's been an absolute refusal to issue a statewide mask mandate, although the CDC and every other reputable health organization has said that masks work. In Georgia, where our vaccination rate, well, I talk about vaccination rates, but our infection rates are sky high and growing. In Georgia, where people have been suffering for quite some time, and we have been waiting for leadership from Atlanta. Governor Brian Kemp decides that he will preemptively issue an executive order to prevent local governments in Georgia from issuing any mandate that stops businesses or stifles the economy. And so, I looked at this man and I'm like, really, dude? So, let me get this right. You have not done a doggone thing to help cities in Georgia as we fight through this pandemic. You have been as hands-off can be. While you say it relies on personal responsibility, and yes, sometimes it does, but we also recognize that almost 1 million people, I believe, have died due to COVID. I got to check my number. But we also know there's also black and brown people. We know it's poor people. We know that it's people without access to health care. And rather than just stay out the way, you want to try to get in the way of people and governments that are trying to do something. Now, mind you, there is no mandate anywhere stopping the flow of business. We all agree that our economy is important. We also agree that we need to do all we can to keep our businesses and small businesses vibrant. But we also agree, and it's a fact, that Savannah not only had the first mask mandate in Georgia, we also shut businesses down as well. And guess what? Our businesses have roared back because we followed the science. So you have nothing better else to do but to try to stop us from closing businesses when we didn't even say that we were trying to close businesses. We want businesses to be open. Just like you want businesses to be open. But you know what else we want to be open? We want the Department of Labor to be open, Governor. Because you know why? Because Savannahans have been trying to get their unemployment assistance now for over a year. And some of them, they can't get a phone call back. They can't visit the Savannah office. You want businesses open, but you won't allow the Georgia Department of Labor, their field office in Savannah, to be open. Seems a little hypocritical to me. You want businesses to be open, but the governor's mansion is not open. So you want to keep businesses open, but what about where you live, Governor? It's hypocritical. And it was unnecessary. And we gonna do what we gonna do. And if we need to go to court, we will go to court. As you know, you lack the legal standing. We know that, which is why you could not continue your lawsuit against Atlanta Mayor Keisha Lance Bottoms, because you knew, just as well as we knew, that you had no legal standing. So, you issue this thing again, make us look crazy across the country to try to stop cities from protecting our folks. Now, and this is for the people who are watching, because some of y'all are watching, and, you know, we know that you're watching. So, I mean, it's okay. It's cool. But my point is, I know we have really gained an alliance between myself, Atlanta Mayor Keisha Lance Bottoms, Augusta Mayor Hardy Davis, and Athens Clarke County Mayor Kelly Girtz. And I will tell you that these mayors, Mayor Bottoms, Mayor Girtz, Mayor Davis, if you live in Atlanta, if you live in Augusta, if you live in Athens, I want you to know what phenomenal mayors you have, because we have been working together to work to save our folks against our own government who's working against us. I'm saying. Paula? No, we're not crowdfunding today. It hasn't been laid in my heart, Paula. So, sorry, but if you want to donate to some good cause, there are plenty of good causes for you to do, Paula. So, that's my issue. Amber, well, I will tell you that all the shootings in Savannah, well, let me tell you one thing. More people are sick than have been shot in Savannah over 10 years. How about that? Let me tell you more. More people have died because of COVID that have died from gunshots in probably the last 20 years. How about that? So if you want to talk, you come with your facts, and I'll give you mine. COVID is a much bigger threat to us than gunshots. So don't even try to play that revisionist stuff. Get your facts right. So, we are ready to deal with that. And the mayors of Atlanta, Savannah, Augusta, and Athens are, we're going to do what's necessary based on our individual situations. But, no weapon formed will prosper. And Dana, when you're ready to vote me out, election is in 2023, have your way. But as of right now, today, I'm the mayor here. So, I mean, I'm good. I was somebody before I became mayor. Now, Chanel, I love you too. We want people to do this, and I just pray to all of y'all, all of y'all that are hating so bad, I hope you don't get COVID. You know, and that's the thing about it. I really hope that you don't get COVID. I really don't. I really don't. I really don't want you to get COVID. But I would tell Governor Kemp that he, he don't seem concerned about unemployment assistance for people who have been trying to feed their families for months because they can't get a return phone call from the Georgia Department of Labor. If you want to show leadership about keeping things open, then why don't you open the Georgia Department of Labor? If you want to show leadership about keeping things open, then open the governor's mansion so I can take a tour. Matter of fact, so we can all take a tour. Since COVID really don't hurt anybody, we'll walk through. And if you don't want to mandate masks, maybe we'll walk through the governor's mansion without wearing a mask. Anyway. Chris, yeah, I got my wagon hitched to that winner, my mama and my daddy from New York. How about that? So, let us move on. So, that's where I am today. I hate being embarrassed on the national stage. I mean, I don't know who the governor thinks he's trying to impress. What he doesn't realize is that healthy people build healthy businesses. Healthy businesses build a healthy economy. It is not healthy in a healthy economy and screw the people. And that's what he's saying. Screw the people. I'm concerned about business. No, I'm saying I'm concerned about businesses too. But I know that businesses are comprised of people. Let's do all we can to keep businesses open. Do a statewide mask mandate. Or, hey, be real bold. Let's do a vaccination mandate. Or let's see some money from the state to be able to encourage people to be able to get vaccinated. Let's see that leadership. Okay? Paula, I'm not even listening to you tonight, so next. Yaya, we did something last Monday. We did a talk. You missed it. I had Dr. Reddick on and Dr. Russell Petty on to talk about that. So we'd already done that. Andrew, don't post stuff up here. So I'm letting you know now, Andrew. Don't post stuff here. So if you do it, it's going to disappear. And you keep doing it, then it doesn't end well for you. Okay? So Yaya, we did a session on Monday. We did it on Monday, this past Monday. So anyway, good to see you, Jossie. Thank you. But here in Chatham County, we have been working well together. I met with Chairman Ellis. I met with Superintendent Dr. Levette. I've met with the CAT Director, Valerie Ragland. And what we're trying to do is to come up with one path for us to get our employees vaccinated. And so we are working jointly on a unified plan for our respective bodies to adopt so that we can create an incentive program to get people vaccinated. We recognize that we have to get our numbers up. And we recognize that we don't have enough police officers vaccinated. We recognize we don't have enough firefighters vaccinated. We recognize we don't have enough front line workers vaccinated. And so we recognize that we have to do more. And so we are working together to be able to come up with a plan. And so I'm helping I'm helping people to do that. Um, and so I'm hoping that we will be able to make that happen. And we're hoping to do that really within the next couple of days. And I'm glad that we are hoping that our community, by working together, can show a united front. And I think that you all deserve to see your governments still working together. I think you deserve to see your city, your county, your school board working together. And that is what we are trying to do, to help to encourage vaccinations within, thank you, Christina, within our organizations. So stay tuned, and we will see it happening soon. Now, let's go to the schools. Hey, good to see Ruin Thai. I need to go to Ruin Thai tonight. What time y'all close? Y'all closed yet? I'm hungry. I might need to go to Ruin Thai and get something to eat tonight. But let me tell you, schools are open. I think that at this point, I think that schools need to be open. It appears at this point that the number of infected young people and staff are minimal. It appears that the number of infected staff are minimal. As long as we're able to manage that within a certain percentage point, I think the schools need to be open, and we fight through it. As long as, and this is just me, I am not associated with the school board. I am not over the school board. So let's be very clear. This is Van Johnson, the citizen, Van Johnson, who has not chick nor child, but all 37,000 of those kids are mine too. This is Van Johnson, who pays taxes as well. I know, and you do too, that we are concerned that if schools are closed, it does a couple of things. All right. Now, Andrew, I think, has gone. Good night, Andrew. But anyway, I think that schools need to remain open as long as they're able to manage the, as long as they're able to manage the number of kids and number of staff being infected. As long as they have a way to identify who's infected, isolate those that have been infected and exposed, and if they have an effective way of notifying the parents and those that are around, then I'm cool with that. Because the issue is this. Andrew has gone to bed for the evening, so good night, Andrew. Right now, Shanika, the numbers, the data says that it is working. It's within a manageable level. Now, let's be very clear about what closing schools. I hear people close schools. To me, it's not that easy, because if you close schools, you've essentially stopped parents from working, particularly parents that are single parents, particularly parents that need to work. every parent can't just take off and be home with their child. What happens then? When you have a parent now that can't get leave off of their job to work. And COVID, because the schools are closed, is not going to be an excuse for that parent to be able to take off of work. And many won't be able to take off of work with pay. So I just want you. I understand that. Deidre, no, not so many children are sick. We have 37,000 kids in our school system. And I believe it's a very small percentage. It's certainly less than 5% that are actually sick. 37,000 kids in school right now. So all I'm saying is that there is a domino effect that occurs when schools are closed. And the same parents that say shut schools down are the same parents that can't take off of work to be with their underage kids at home every single day. So I applaud the school system for trying. Now, I know that there are two things that need to happen. First of all, parents, you need to be vaccinated. And some of the parents that are complaining aren't vaccinated. You got to get vaccinated. That's the first thing. Secondly, you need to insist that your young people need to wear a mask. And you train them, you teach them that. To protect them and to protect you. To wear a mask. And let them see you doing it. You're the teacher. Let them see you modeling that type of behavior. And I think that we should go as long as we possibly can. And again, I speak to Dr. Levette often, and there is a threshold by which we need to be able to shut the school down or at least move to a hybrid model. When we close schools, we also close daycare centers because the daycare centers also go in line with the schools. So now, what do? Because there's not going to be any more stimulus. What do? You can't get unemployment now for being unemployed. You're not going to be able to get unemployment because your child is out due to COVID. So now you can't pay your rent. Now you can't buy food. Now you can't pay your bills. And you know who that affects the most? It affects poor people. It affects black and brown people. And so now we have further victimized those that are already victimized by life. All I'm saying is, let's try. And all I said to our superintendent is try. Caitlin, I do not know what that threshold is. I do know that it is Lamb. I don't know anything about Regin Cove. I don't know anything about that. So all I'm saying is we have to do what we can to try to keep our folks, our kids, our families out of the hospitals because our hospitals are full. They're full. And so that's why I need your help. Parents, you want to protect your kid. You can't say, I'm concerned about my kid being around kids that are unvaccinated and you're walking around unvaccinated too. You're just as much of a threat to your child as they are going to school. As a matter of fact, they might be safer going to school with a mask on than being home with you without a mask on. Real talk. Real talk. And so all I'm saying to you is that that's a concern. That's a concern. This is not going to be easy. But I think we have to try. No, Margie, I didn't say it was just black and brown. I said the most, because the system is majority black and brown. So it just disproportionately affects them the most. But I need you, no Deidre, the hospitals are mostly full with those that are unvaccinated. As a matter of fact, between 85 and 90% of those that are in the hospital due to COVID are unvaccinated. Okay? Over between 85 and 90% of those that are in the hospital due to COVID are unvaccinated. That's facts from where we are. So you have 100 people in there, 15 are vaccinated. And those that are vaccinated have underlying health conditions. That's truth too. So all I'm saying is we don't know, we're doing the best we can. And I think it's kind of rough for everybody who, slam people. We're quick to slam people based on the things that we think or the things that we want or the things we think we should do. And, I think it's unfortunate that, let's find ways to help people and pray for people that have to make these types of decisions. It's a no-win situation sometimes, no matter what you do. All I'm saying is we have to do what we can do while we can do it. The only person on here that is a medical doctor, I believe, I saw Dr. Heather is on here. And so she's a real doctor for real. The rest of y'all, you're reading articles and you're doing WebMD. I have a medical advisory team that is on par among the best doctors in the nation. I have the medical director, associate medical director of Memorial, the medical director of Candler. I have the executive director of the J.C. Lewis Healthcare Center. I have the medical director of the Curtis Cooper Healthcare System. Michael, don't post stuff here, man. That's your first warning. And I'm just saying to you all, this is where I'm getting my information from because I don't know. I'm not a doctor. And so it doesn't make sense for me to try to do that which I'm not trained to do. I leave education. I can leave education to education. I leave medicine to the medicine folks. And then I get my advice from them. Because they know best. And because you have read some clandestine article somewhere and you want to put that out as fact and you haven't spent a day in medical school, have no certifications whatsoever, I'm sorry, I can't take credence in the things that you say. What we have done is in line with what the major healthcare epidemiology infectious diseases have done across the nation. So I'm saying, Justin wants to know if masks work and you're wearing it, then should you be safe if you are out in the area with an unmasked person? Well, not necessarily, because we know that masks do not stop COVID. Masks only block COVID. And so some of it gets through. And so essentially, if I'm wearing a barrier and you're wearing a barrier, then hopefully the amount of aerosol COVID that goes in the air is minimized. That's where it comes from. Okay? So, what may I leave us with? I say we continue to keep the faith and follow the signs. I continue to say that we recognize that there is someone bigger than you and I. I say that we continue to hope and believe believe in our faith, in whomever we have faith in, that we will get through this, even if we don't know how we'll get through it or when we'll get through it. But in the meantime, we still take advantage of the science that's been provided for us. And the science says that there's a vaccination that works. I'm saying I've been vaccinated and I'm still good. That's why I give so much credence to Dawn Baker. Dawn Baker was in the clinical trials, the phase 3 trials. She was the first person to get the Moderna phase 3 trial in the world. Dawn Baker did, right here in Savannah. So I'm just saying, what am I saying? The mask does not block it. Vaccine does not stop it either. Nothing's going to stop it. I didn't say that. I said mask reduce it, and the vaccine reduces your probability of becoming violently sick or going to the hospital or dying. And the facts have bear that out. So I'm just saying, we have got to keep the faith. We've got to follow the science. You know, it's amazing that we grew up at a time of vaccines and y'all got those vaccines and it didn't bother y'all one bit. Mask and vaccines should not be, it should not be political, which is why we've tried very hard here in Savannah to make sure that we were engaging with medical personnel. Any mandate that we have done, any orders that we have given as it relates to COVID has been because of the advice of medical professionals, people with MD behind their name, to include the district health director, Dr. Lauren Davis. And so all I'm saying is, if you say nothing is going to stop it, I mean, nobody said that. Well, I'm saying you protect yourself as best you can by using the tools that are afforded to you. Okay? Now, we know that well, Deidre, we want you to follow Jesus. We want you to follow whoever it is you follow. But we also says, there's a point to be made about that. I'll go ahead and since y'all went to the faith thing, I mean, we'll go ahead and we'll go there for a minute because I think that it definitely bears some discussion. Because we talk about this faith thing, but faith doesn't tell you to be foolish. It doesn't. Faith would not have us to be foolish. That's not the purpose or the meaning of faith. So for those of you who are bent on that, I want to remind you of that there are other things you can do to be able to keep yourself safe. And you should do all you can to keep yourself safe. So I'm gonna leave you tonight with this. Proverbs 27:12. A prudent person foresees danger and takes precautions. The simpleton goes blindly on and suffers the consequences. So for those of you who trust Jesus and trust the Bible, I mean, if that's where you want to go to Proverbs 27:12. A prudent person foresees danger and takes precautions. The simpleton goes blindly on and suffers the consequences. My question to you tonight is, who are you? Good to see you, Shantae. Are you going to be the prudent person that foresees danger and takes precautions? Or are you going to be the simpleton that goes blindly on and suffers the consequences? Give your 12-year-old the keys and let them go out and drive your car. You won't let them do it, though. Why don't you go ahead and let them have a joint or let them drink a beer? Go ahead, let them have a shot of Hennessy. No, we don't do that, right? No, we don't. I'm just saying. Are you going to be a prudent person or are you going to be the simpleton? Are you going to be prudent and you're going to take precautions? You're going to wear a mask? You're going to wash your hands? You're going to get the vaccine? You're going to keep your distance? Or are you going to be the simpleton that goes blindly on and catch COVID and either die or have someone close to you to die or have to be in a position where you're going to a doctor, which has happened here, and say, oh, I need help. And our doctors have told us people get COVID, they get violently sick, and all of a sudden they want the vaccine. Too late. Who are you going to be? I'm going to be prudent. Because I'm trying to live. I'm going to take the advice of those who know. Those who have MD behind their name. Not those who have WebMD in front of their name. Because you Google it doesn't necessarily mean that it's correct. I'm going to keep the faith and I'm going to follow the science. I'm going to be prudent. I'm going to foresee the danger. And I'm going to take the precautions. Because I don't want another person in Savannah to die, another person in Savannah to be infected, another child to suffer because we were not prudent and we did not take precautions. And you're seeing it across the country, husband and wife dying, mother and daughter dying of COVID. I'm sorry. If there are things I can do to help to protect myself, Deidre, I lived through the blood. I also lived through wisdom. The Lord also grants you wisdom. So you lived through the blood, but you also lived through wisdom. Because if that's the case, you live through the blood, then why don't you go up in the plane and jump off the plane and say, hey, through the blood I live. Come on now. Doesn't make sense. Don't tempt God. But anyway, so are you going to be prudent? Or are you going to be the simpleton? I don't want you to be a simpleton. And I understand that some of you will be simpletons. And you will suffer the consequences. And for some of you, unfortunately, and I hope it's not so, the consequences will be deadly. For you or for someone you love. Your life means much more than that. It means more than you beating your chest and saying, I'm not going to do this. It's more than that. We want you to live. We want you to be okay. We want your kids to grow up to be great people. We want you to live into your old age. Yeah. Do what you can to protect yourself. Do what you can to protect your family. Do what you can to protect your children. Well, Ebony, didn't Ebony do you? If you're not, I just hope that you're going to be okay. But I bet you there are people who are in here that have suffered COVID, who've suffered loss. And I'll take a moment. If you have had COVID or if you have lost someone to COVID, put that in the chat right quick. Because those people will tell you you don't want to be a part of that story. You don't want it. And so that's why I'm wearing a mask. Because I don't want it. I don't want to try it. I'm just saying. I'm not trying to go to no hospitals. I'm just not trying to do it. Is Chantel acting up? Chantel, don't act up. Um, don't go there. What about the other doctors and scientists who are being censored? I don't know anything about that. Again, um, I I go with the doctors of our coastal health district and with our hospitals. So, you know, I go with those that are in the seats. All right, Antoinette lost two uncles. Chanel lost three people. Um, so, uh, Glenda has two family members fighting in the hospital. Joy lost her grandfather to COVID. Alicia lost an aunt and a CAP grad, a construction apprenticeship grad. Sarah lost a first cousin in Savannah. Caitlin had it and lost several family members due to it. Tayana, I hope you do better, sweetie. She's fighting it right now. Judy Jones buried a family member today who had COVID. Lisa had two pass in the hospital now. Amy had it. Her child's father passed away from it. Shanda lost her mom. I'm sorry, sweetie. Debbie lost two aunts. Beat lost a brother-in-law and son's aunt. Christina lost three family members. Sonia lost her uncle and her cousin Cynthia. Adrian lost two members to COVID. Come on, y'all. Come on. Nia got the shot, and she don't wish it on nobody. Talisha got had lost two family friends who passed. Cynthia lost four people. Annette lost a cousin this week. Paul lost family members and church members. Bishop Ship lost five family members. All right, you understand what I'm saying? I mean, for those of y'all who want to sit there and talk about that, Heather lost four people. I'm just saying. Pretty Brown, her son lost his auntie. Hannah had lost seven of her friends have lost their parents. Nia lost her brother, her sister and niece and her brother. Edwina had it back in February. Y'all see this? Carrie's dad had COVID and is fighting it as hard as he can. Ernestine lost so many. So to all of you all who lost everything, I mean, Bella lost her grandfather. Come on, y'all. Come on. So all I'm saying to you, Sarah lost a church member. Debbie lost 26 people. Well, 26 people had COVID. Lynette's son and daughter-in-law are. All I'm saying to you is this. If you don't think it's real, ask those folks. This is no fluke, y'all. This is real. And for every COVID person that goes into the hospital, we are putting our healthcare workers, our nurses, our doctors, our techs, our custodians, our healthcare workers, our healthcare heroes, we are putting them at risk every time we do it. Every time we do it. So to all of you who have lost family and friends, you certainly have my condolences. For all of you who have suffered, I'm glad that you're better. And for those of you who are wondering, still thinking, still on the fence, look at the testimony of those who've lost. And some people have lost it all. Don't be one of them. The question this day, will you be a prudent person that foresees danger and takes precautions, or you're going to be the simpleton that goes blindly on and suffer the consequences. I don't want you to suffer the consequences. So, Christy, I'm not putting him at risk. If those doctors become the leads at the Coastal Health District, I listen to doctors in position. Okay, if the Coastal Health Director tells me that that is so, then I'll listen. If the CDC says it, I'll listen to them. If the lead doctors of our medical directors of our hospitals or our federally funded healthcare systems say it, then I'll say it. I mean, they're not here in Savannah. So that's where we are. Be prudent. Be smart. Okay? And April, I understand that. But I mean, I'm just saying what I'm saying. But let's get the shot. Let's get past this. Let's wash our hands. Let's wear our masks. And let us watch our distance. And Edna, we are praying for your adopted mom. And Julie says all 3 times she caught it, she was being hard-headed, not keeping her mask on. But now you won't catch her doing that. Mari says her mom lost her pastor. Chanel, I do not know the death rate. You can go to the website and see how many people have died in Savannah due to COVID. I can find that out right quick. Let me look. How many people have died in Savannah due to COVID? I believe it was it's between 450 and 500 people. So anyway, Christy, contact our health director. Again, I'm not getting in the middle of all that. If our doctors, if my medical team tells us that we need to change direction, we'll change direction. Okay? So, God bless you all. Thank you so much. Let's be smart. Let's be prudent. Let's not be the simpleton. Thank you so much. Look forward to seeing you on Monday night, and we'll see what Monday Night Live has for us. God bless you all. Good night.